In this video, I'll show you how to use this PPI tapering and deprescribing toolkit that I made in Google Sheet. Okay, this toolkit is designed to be simple, practical, not to overwhelm you or for guidance only. Let's start at the top. Here you can enter the patient name and notes or any annotation you have in mind. On the left side, the overall tracker shows progress across phases. Phase 1, which is P1, Phase 2, which is P2, and Phase 3, which is P3. So you can quickly see whether tapering is still in progress, completed, or stopped. Let's go over at the center. You'll see there the treatment details. Phase 1 is the original PPI treatment period. It is usually 2 to 4 weeks duration of your PPI treatment, and you need to be more consistent for this one. For Phase 2 is tapering weeks. Either you are already reducing the dose for your PPI or switching to every other day dosing. So it really depends on what dose did you start. If 40 mg, try to reduce it to 20 mg, then make it every other day. While if you started 20 mg, then have it every other day as recommended. Next is your Phase 3. For Phase 3 is the week finally you are now stopping with your PPI. In the last part, for Phase 4, this is an optional. In this case, symptom management weeks using antacids or H2 blockers as needed only. It is better to start once than after as needed. The duration here are general clinical guidance and can be adjusted based on the prescriber plan. Next part is on the right side is the timeline checker. This lets you visually track tapering over days or weeks using simple checkboxes. There are no graphs, no calculations, just a clear way to follow progress and avoid abrupt stopping. This is good for any patient as guidance. So if you are clinicians, you can offer this one to any patient as their toolkit as home tapering guidance. Simply, the goal here is not to rush stopping. It is reduce rebound symptom, support patient comfort, and allow stomach to adjust gradually while monitoring symptoms. For safety reminder, if symptoms worsen, persist, or even warning signs like difficulty on swallowing or bleeding occur, the taper should stop and medical review with your doctor as needed. This toolkit again is designed to be simple, practical, and not to overwhelm, just a guidance. You can now download it below, and as always, medication changes should be discussed with your licensed healthcare professional.